And our, yes, thank you. Our meeting is going to be recorded. So you're presently received a request to continue. Dr. Geneviève Matte is our conférencier for this. I'm going to read her bio for you right now. She is a neuromuscular medicine expert and neurologist working at CHUM, the Centre Hospitalier de l'Université de Montréal, since 2010. She is assistant professor in the Department of Neuroscience at the University of Montreal and the principal investigator at CHUM Research Center. Her clinical and research interests are electrophysiology, neuromuscular ultrasound, clinical trials, and telemedicine as tools to improve care for patients with neuromuscular disorders and ALS. Dr. Matte is the director of the ALS and Motor Neuron Disease Clinic at CHUM and recently became chair-elect of the Canadian ALS Research Network, CALS. Welcome, Dr. Matte.
Thank you, Kate. Hi, everyone. Thank you for being with us this afternoon. So I'll present on telehealth as an advantage for ALS clinic and ALS patients. As you know, interdisciplinary care is central to ALS care. So I will be with my team, Mr. Carl Larocque, speech and language pathologist, Manon Mousseau, psychologist, and Sophie Villemer, nurse coordinator. There we go. So the objectives of this talk is to show you how telehealth may maintain care throughout the pandemic, but also how it enhances regular care delivery, how it can help technology-wise, and what are the best approaches and the resources available. So thank you again to ALS Quebec to give us some time and opportunity to reunite and talk about something that passionates us with you. And also thank you to Mr. Makmasi and Mitsutanabe Pharma for Canada for their support in kind for translation and also for lunch and facilitating this meeting. So here are different interests I may have aside from caring for patients with ALS, different research and presentation honoraries and consulting fees. So what's telehealth? Well, telehealth is any technology that allows a healthcare professional to follow up on patients from a distance. So it's either through making appointments, bringing together people, getting data for clinical care or research. And the goals of this are to increase accessibility to any patient, whatever stage of disease they're at, and provide care in a timely manner, and promote patient involvement as a partner in their care. So our main objective at the start of this project back over a year ago was to maintain lifelong quality of care for patients with ALS, regardless of their geographic location. So the platform we've chosen here at CHUM is REACT. There are several other ones that are valid. REACT was created by a Quebec physician, and it's actually making partnerships with several other companies like Philips for ultrasound. And this platform allows a safe, confidential conversation between a healthcare professional and a patient. It allows also for file transfer, messaging, augmented reality. Augmented reality is mainly for a teaching purpose, but may become useful in clinical practice one day. Is it easy to use? Well, so this platform has to be downloaded, has a bit of its own idiosyncrasies, but overall, if you've made it to this call, you can have a telehealth appointment. and it's relatively easy. So what can we do during a telehealth visit? Well, just as when you come in the clinic to see us, we can proceed to clinical questionnaires, the ALS-FRS, a physical examination. So neurology is a specialty in which observation is key. It's very important. And through the video, we can observe certain characteristics. We can also hear your voice and speech, and then we can make some conclusions. It's not only used by physicians, it can also be used by psychologists, can evaluate communication as well. There are some data that can be collected from connected devices. So on a clinical basis, some of you may have a BiPAP at home. So the memory card is read by PNAVD from a distance. So that's one. And in research settings, there are others being developed or currently used. It allows for easy unscheduled visits if there's any intercurrent illness. So for instance, a problem with the PEG tube, an appointment can be set up and we can look at the problem from a distance and decide, triage problems and see if it needs assessment in person or if someone locally is better, is in a better position to intervene. It allows for interdisciplinary multilateral meetings, so with CLSC, or just within a team. As you know, with COVID, we need to respect some physical distancing, and it may make holding a meeting difficult. So this kind of technology may help us. So from the information gathered through a telehealth visit, we can often make a diagnosis, or at least a differential diagnosis, or all the possibilities, and make an investigation and treatment plan. The telehealth may also serve education, so either to the patient, what to do with certain in certain situations, and also with other healthcare professionals. And telehealth also helps with research. Several protocols that clinical trials that were running prior to COVID were able to complete the assessments remotely. And new protocols will also include remote assessments and telehealth in order to collect valid data and pursue the goal of finding a cure for ALS. There are some limitations. Nothing's perfect. So in terms of physical examinations, there are things that we cannot necessarily do at a distance if there's no one to actually touch at certain points to see where does it hurt or what structures may be involved. So that's one of the limitations. Pulmonary function tests, aside from research settings in which the patient is handed a device that they can use at home, and modified barium swallow need an equipment that cannot be done remotely. So the state of telehealth in 2020 is pretty much medical interdisciplinary evaluation and some remote data transmission. As I mentioned, the BiPAP data card, pulmonary function tests, provided the patient has the device, often lent for research. Some evaluation of communication is possible and some movement assessment. Currently, movement is mainly in research setting, but it's through connected device. So similar to what some of you may have, Fitbit and Apple Watches and other connected watches. So telehealth came to the ALS clinic in summer 2019 through the experience of Mrs. Manon Mousseau, clinical psychologist at the clinic. And I'll turn the computer to her, literally, to let her explain her experience and the scientific evidence that back the positive experience it can be.
Thank you, Dr. Matte. Good day, everybody. I'm Manon Mousseau, the psychologist. I work at the CHUM at the ELS clinic since spring 2019. So what I want to discuss today is a main concern for most of psychologists about psychological services at distance is, can we offer services that can be effective and preserve the quality of the therapeutic alliance, which we could define as the collaboration between a patient and his therapist. So what is interesting to know is that before the pandemic, telepsychology was not very much used by therapists, even if we knew based on more than 15 years of research that it could be effective. And also, even if we had the practical guidelines from the Order of Psychologists of Quebec, who approved this modality and helped us to guide us with our offer. So research has demonstrated that this resistance came mainly from the therapists who were concerned about this quality of the alliance, therapeutic alliance. And of course, it's understandable. The emotional component was an issue for therapists, and it's logic considering that emotions are a big part of psychotherapy. When I arrived at the clinic in 2019, it was obvious for me that patients with ALS could benefit of the services. As we know, sessions in psychotherapy are really frequent. It can come as often as once a week or once every 2 weeks. So it was demanding for the patients it would be demanding to ask for to the patient to come at the hospital at this frequency. So we also have patients that come from remote areas. So given the opportunity to have access to telepsychology was a great advantage for them. And the gain was while we were in pandemic and everything was stopped, our patients could benefit of the services. So there was no interruption in the psychotherapy. As I use it since 2 years and maybe more because I worked in the past in a remote area, I could see now advantage and some limitations, as Dr. Matte already told us. No, but nothing is perfect, but can be improved. So the advantage for me seems to be for the patients mainly, as they have having less travel for them is a great advantage. Could be coming in the center of town, paying for parkings or asking for members of the family to have work leave. So those advantages seems to be important. And we can see that there are less missed appointments, which from my point of view can only benefit to the psychotherapy. Of course, the quality of the therapeutic alliance is maintained. It was already known by the research, but my observation goes toward this direction too. Before the pandemic, I would not offer only session in psychotherapy, but now I offer it and it's going well and the results are there. Of course, React is a platform that allows security of the data, and the confidentiality seems to be preserved, which is a great advantage too. And it's also less traveling for the professional. The hospital is a big hospital here at the CHUM, so we don't have to do as much displacement to go to the rooms to see our patients. We can work from our office, which is good too. For about the limitations, I would say with humility that it requires some technological skills that sometimes I don't possess. And also I can see that some patients are not responding as well as telepsychology that they would respond in person. It can lead also the fact that we use it more frequently now. It can lead to cognitive fatigue, and I can see that at the end of the day when I made all my sessions on React, for example. I put some tips and solutions about some challenge that we meet in psychotherapy. This perception of coldness that was shared by a lot of psychologists. I could say that we can do things to improve that, imitate as much as possible the in-person sessions, saying about the noise or the light. I noticed also that as a therapist, I verbalize more about my empathy, which I rely in the past on my nonverbal cues. Now I can, for example, say, okay, what you are saying right now moves me, so I noticed some change. And we will see with time other change also about this subject. The security of the patient, we have to take that into account. It's not often, but at times patient can be more fragile. It's important for the therapist to have for example, I can keep the address at hand. So if something could happen during a session, I could be able to do something fast. Could also be having a psychosocial team in the area of the patient too. About the connection problems and the technological skills, of course, what is really helping is when a member of family or friend is there to install the session. So it's going well when a person is there. If not, with experience now, I don't lose too much time in the session. I switch to the phone when I see that it's not working well. And it's doing well for patients to doing that on the phone. Another parameter that we have to take into account is the environment of the patient, which I don't always control as much. So in the beginning, before we plan the sessions, it's important that we discuss the fact that the patient needs to have a quiet room, a place where he will not be disturbed. It could be also by planning the sessions at a moment of the day where he will not be disturbed. Those are things that are effective too. So in conclusion, is it possible to offer services, psychological services that are effective as much as for the psychotherapy or for the quality of the therapeutic alliance? I would say yes, the results are there. And it would be too bad to don't offer those services. With the pandemic now, a lot of psychologists have integrated this modality to their offer. Telepsychology is appreciated by patients, even if there are concerns that are expressed in the beginning, which is normal, but it's going well for their point of view. The advantages seem to be about the logistic, obviously for the patient, but sometimes for the professional too. And this resistance about the quality of the therapeutic alliance can be overcome, of course. About the limitation, of course, the increase in the use of this modality brings some observations. There are a lot of research that are actually starting. I was invited a couple of days ago to participate in one research about the efficacy of the telepsychology, which I intend to accept, of course. I would like to know more about this cognitive fatigue. What can we do with the patients who are not responding as well at the modality? So I suppose that we will have more information with time. Are we going toward hybrid model, which would integrate in-person and telepsychology sessions? My intuition tells me that it's the way to go, but we will know more in the future. So thank you very much.
Sorry about this switch. Okay, thank you. Thank you very much, Manon. So, so telehealth has been, after the successes of Manon with one of our unfortunate patients who couldn't come easily to the clinic anymore, we started to build our program well, in the fall of 2019, and that is presenting it to the CUF. So CUF, le Centre d'Optimisation des Flux Réseaux. This is this organization optimizing the patient care, basically, either making it accessible to people outside, from outside the Montreal area, but also helping our patients manage at home after surgery, after being admitted. And telehealth is part of this initiative from CHUM. So we defined the patient journey, and you might recognize your own if you're a patient, or what you've seen as someone involved in the field. So patient is first seen in neuromuscular consultation at an outpatient clinic, the EMG lab. I must say the 3 neurologists here at CHUM do both consultation and EMG all at once. It's a prolongation of our physical examination. And unfortunately, we sometimes have to confirm an ALS diagnosis. So the patient is then considered a patient of the ALS and motor neuron disease clinic. And the basis of follow-up is about every 3 months with all the assessments recommended in the best practices. And this interval may be modified depending on the patient's needs or different problems that may happen. We were to consider telehealth for restrictions, different difficulties that may arise. So some things like the weather, like today in Montreal was very slippery with a mix of snow and rain, or just geographical situations. So patients being just out of Montreal greater area. Or unfortunately, if the disease progresses so that patients are too tired or in no condition to leave the house. And the plan was to maintain some visits in person, because there are some assessments, as I said, pulmonary function tests, swallowing assessments that can not really be done on a regular basis from home. So if we talk a bit more into administrative terms, the goal is to give seamless care throughout the disease trajectory of the patient and retain the ability of receiving tertiary and quaternary services. And to address a question we had prior, we keep seeing patients who are in long-term care facilities. Thankfully to the staff over there that really was on board with it and facilitated the communication with our patients. So our objective back last fall was to implement the teleconsultation services. And in terms of challenges, it was a no-brainer. We have about 20% no-shows that could be avoided, as often problems with traveling, coming here. And A visit in ALS clinic takes a lot of the patient's energy and involves a lot of people, their family, who may still be working or just having other responsibilities. So there were several reasons why this would be a benefit to us. Never that we thought that it would be included in safe care delivery like now for with COVID-19. So in terms of performance indicators and research points we will be measuring, we want to improve the patient's and family experience of healthcare, maintain the patient's quality of life, keep their energy. Patients have a lot of things to do, a lot of things going on aside from coming to see us. Maintain specialized care until the end of life, and reduce some travel costs and burden, and provide access during intercurring illness so we can see different complications for PEG tubes, other wounds, or other issues that may arise. In terms of the team, well, some are not measurable, but we'd like to demonstrate that attendance is better. Right now with COVID, it's a bit of a, there's not really a choice for some people in some circumstances, but we think it's going to be a game changer. And well, for our hospital, although it's very large, it still doesn't have enough room, apparently. So being able to do some visits from your own office instead of requiring a clinic room is not negligible. The information can be managed securely, and we can keep the pace of visits. We all have a few patients who, for good reasons, don't want to come during winter months. So we not lose track, but follow them from further between November and April. And well, it's totally in line with our tertiary quaternary mission as a university hospital. And in terms of network, well, it's going to nurture our connection with the CLSC, CHSLD, and hopefully improve continuity of care. So telehealth in ALS has been thought of a lot in the last few years. People have seen how just video conferencing has been just something we use almost daily for 10, 15 years now. So it's very easy to find literature after April 2020, and they all have COVID-19 in the title. But if we look at evidence collected prior to that, when patients and healthcare professionals had the choice to provide care in person, we find it's an option that's feasible and acceptable in several settings in different countries. So in the United States, but as well in Europe, it's been totally, it's been a positive experience in all ALS clinics in which it was implanted. In terms of patient outcome, the VA in Cleveland has looked at this, and survival rate of decline and use of different life-sustaining measures were the same. So patients don't seem to lose on anything being followed by telehealth. And also, well, research in terms of research has shown that it's been feasible and was able to collect valid data. So several of the new clinical trials coming up will have remote assessments. So, and now I think rather than just talking about scientific evidence and how we see this as healthcare professional, I'd like to invite Mr. Claude Lapierre, a patient of our clinic, who's nicely agreed to testify of his experience with telehealth. Mr. Lapierre, thank you very much again, and I'll let you share your experience.
Thank you, Dr. Matte. I've been diagnosed with ALS in April 2016, and I'm using telehealth since a year. I think I was the first patient with Dr. Battez and works with Dr. Matte. That was a start for everyone, so it went well. What I have to say is that I think you covered a lot of things, but the important thing for us, for the patient, is we're at home. A day like today, you don't want to go to the hospital. You want to stay home if possible, and just having another meeting with the doctor a little bit later. But it's important that we stay, if we can, at home. It's easier. The good thing about the telehealth is that I feel that the therapists are easier to contact, and if we have something, it's the feeling I have, it's easier for everyone. So I think it's very important. The other thing is that the platform that you're using with React are good. I mean, sometimes it's easier for the patient with Zoom or Microsoft Teams, something like that. But you're using React a little bit. I think the important thing is to use it once, and after that, it's easier for everyone, for the patient. For the doctor, you're using it on a regular basis, so it's easier. But for the patient, we just have to have one time to use it. But if you have a problem, you have someone at the CHUM that can help you, and which make a big difference. So I think it's important. Couple of things is that my feeling of telehealth is, I think it's so great, but we miss the human contact. And that's something that when you have that disease, that you need to have that contact and feel more secure. And I think that's important for us. But don't get me wrong, telehealth is fantastic. And it's the best thing that happened. And like I was saying before, maybe technology will change, and maybe in the future we'll be able to have some tests online. Who knows? Could be interesting. But I have only good things to say about telehealth, and it does definitely make my life easier.
Mm. Yes, thank you very much, Mr. Lapierre. Yeah, no, it's true that we also miss you, and I think the ideal would be to have patients come in when they can, but once it's more difficult, probably alternate, and because we're also afraid as healthcare professionals to miss out on some things, and there are things, unfortunately, that are not doable from a distance, such as measuring pulmonary capacity. Yeah. And we don't want to deprive patients of care that could be of benefit to them, such as BiPAP. So, and as you said, perhaps technology will help us get proxies or other tests from remotely that we can interpret and use to treat patients without the in-person visit. And as you said, yes, most people don't have the health to sustain COVID. So it's also an important, like the safety of patients and their caregivers is also a big factor right now.
Yep.
Mm.
Thank you.
Thank you so much. Now I'd like to pass the mic to Sophie Villemer, our nurse clinician, who will share with you practical tips to make the best of your appointment.
Good afternoon. I'm very happy to be here. Actually, it's quite simple what I'm going to talk about. It's really just some tips that are even useful sometimes for a regular appointment with your doctor. So beforehand, what is really, really practical, of course, for the first time you use it, like Monsieur Lapierre said, the application React can be a bit more difficult to download or to actually create your own profile. So as we learned quite quickly in spring, it's better off to always download and start trying to get download half an hour beforehand. We are lucky to have a phone number, like a helpline with the technicians that can also help out for the first time. But actually, I think that after once or twice, it's quite easy. So the second thing is, of course, you have to create your profile. And then let's not forget the password, because it's easy for the first time to just do it. And then you're stressed out and then you actually forget your password. So that was unfortunately something that happened a few times with my patients. Thirdly, well, that goes for any appointments you have with doctors. It's always to prepare your questions. That's always useful to know in advance. What are the things you want to pinpoint in the follow-up of your disease, or any questions that you would have anyways. The other thing, which is really, really, really useful, and I love it, is when the patients have in their hands their medication list. So from the pharmacy, when you get your medication, just to have that at hand, so you can at least just help us to make sure that we have the right information. And at the same time, because we are sometimes in contact with the CLSC professionals, then it's nice to have at hand also their coordinates, so information contact that we can share together. So those three things are actually really, really useful whenever you see us. The best possible conditions, Manon has already said a few things about it, but let's not forget to make sure that the device you're using is fully charged, or at least you connect it, you have the wire to do it when you are having the appointment. After that, the internet, of course, the connection to the internet. Actually, in spring, everybody that had a slow one, I think, had learned quickly that they needed to upgrade the internet. So make sure that the internet connection is possible. The location where you're going to be having your appointment has to be, of course, calm, quiet, to be private as much as possible, so that there's no disruption. Also, we enjoy it when the camera, the position of the camera is really you can fully see at least the upper body and the head, so we can at least see your expressions and have a good conversation. What is also good is when you can have a bit of room behind, so you can maybe back up, get up, and show the doctor a few things that you find are maybe less functioning or something you want to show. So it's nice to be able to move around. With that, of course, if there is a caregiver available, let's not say he doesn't have to be sitting beside the patient, because that's not necessary. But if he's not, if he's close by, and you can just call him to at the same time use the camera to visualize something particular, or to complete some of our questions he might not be able to answer on his own. So sometimes the caregiver is really useful. And I think that's about it. I think I didn't do it in the order, but that's about what that's what it is. So it's quite logic, but it's nice to see them, these points again, to make sure that we are having the best appointments and that we can follow you through those great times we're going through with the pandemic. So that's it for me. Thank you for being here.
Hi. So I think everyone's getting more or less the same emergency alert.
my,
So.
my heart just jumped.
Yeah, the table started vibrating here, so from all the phones. Thank you so much, Sophie, for this very clear tidbits of tips. So as you've seen in the last minutes, telehealth is totally an advantage for ALS patients, their caregivers, and the healthcare professionals in our goal to provide the best care possible. And it's a tool that's been helpful to ensure quality of care during the COVID pandemic, but it will remain. I think the world has changed forever in that sense. And despite uncertainties, despite mishaps, the weather, despite the distance from the clinic or the progression of disease, we can remain your team and help you. Telehealth is user-friendly. Platforms will adjust, and perhaps there'll be changes in the kind we can use. It's fairly accessible to anyone. If you've made it to this call, you probably can make it to a telehealth appointment. And there are several developments in the collection of clinical data for your care and for research. So I thank you very much for your time and attention. Thank you, Mr. Lapierre, for making time for us. He's been sitting through the 2 sessions, both French and English. Thank you so much. And thank you to Mr. Marc Massé for his generous support. Thank you, Marc. And thank you to my team, who's always there for patients and without whom it wouldn't be possible. Everyone's available for questions. So Sophie Villemer, Manon Mousseau, psychologist, and Carl Larocque, speech and language pathologist. So.
Thank you very much, Dr. Matte. Does anybody have any questions or comments that they'd like to share? You can do that by unmuting your mic and speaking. We're a small group, or if you prefer to do it by chat, the chat button is in the middle of your screen at the bottom. You just click on that and send the chat. So we'll wait a minute in case we do have hope.
I'll ask a quick question, and thank you, Dr. Matte, and thank you, Mr. Lapierre, and NT Pharma, of course. You know, this is the pandemic. You know, the positive aspect is it opened all our eyes to technology, and you know, as the ALS Society looks at how do we project what role do we play going forward in serving our clients the best that we can, you know. Some ideas triggered as, you know, can we help people do dry run-throughs with the technology? And so there's things that we will reflect on how we can help families prepare for telehealth, perhaps. Anyways, I'm brainstorming out loud, but, you know, we have to embrace technology, and, you know, we welcome, you know, any thoughts that you think, how can we help, you know, and that will be our commitment. And the other question I have, a little bit more technical, if the caregiver can't be at the appointment, eventually do you see split screens being able to happen, or is that possible already so that they could take part in the telehealth? That's more of a technical question.
Okay, well, thank you for those questions, Claudine. So in terms of how the society can help patients access technology doing run-throughs with the license, it may be a little hurdle, but I think we could overcome it. We usually have either the appointment with Sophie is a test drive, or with the secretary often. Yes, split screens are possible. So actually we can have a family meeting, or even with other professionals. So we can imagine some situations in which it'd be helpful to speak with the team from, like, for instance, the pivot, so the main healthcare professional at the local resource interact with us and the patient if needed be.
Okay. Thank you. Thanks.
Are there any other questions at this moment? certainly don't want to hold people, keep people here. We all have busy days. I'd like to thank Dr. Matte for her presentation, Monsieur Lapierre for your presence here and your presentation as well. I'd also like to thank MT Pharma and Mark Massey and his team for their support, and thank all of the participants for being here. I hope that this has been an interesting conference for you. You may have realized that the conference is being recorded, so it will be put up onto the ALS Society of Quebec's website very shortly. And I wish everybody a wonderful afternoon, and thank you once again for being here with us.
Thank you.
Thank you.